Well, thanks so much for joining us for Speaking of Making Healthcare Work for You. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and we are talking about our interview with Arlen Meyers, who's the president and CEO of the Society of Physician Entrepreneurs. And I found Arlen to be interesting because he has a different take than most people do on medicine and how it should go. He said right now we're dealing with sick care, and mostly it's a sickness of systems. There are so many different systems from Medicare to the VA to all these other specialty areas. And he said, if there's no margin, there's no business, which I thought was interesting. You have to think of the business end of things, and talked about how the US taxpayer is a single payer system into the healthcare system. It's just that the taxpayers are that single system. And so those things were really interesting to me. And then he was talking about the importance of being an entrepreneur and how it's formed at an early age and whether you are a problem solver or a problem seeker. And I thought that was interesting. I think that's just a good tip for life to think about. Wait a second, am I being a problem solver or a problem seeker? So those were my takeaways. What about you, Apoorv?
Thank you, Stephanie. Yes, I really liked a number of his points too. I think one of the key points that he made is that COVID, for example, has presented a great opportunity. It's also exposed some other opportunities which are creating more of a problem. But during COVID, we have telehealth, we have expansion of regulations, we have fast tracking of vaccines and pharmaceuticals. So you're seeing a sort of entrepreneurial energy, and that's what he was alluding to. That's a really interesting way to see what the pandemic has created. Of course, on the other hand, the question that got us there was, do you see entrepreneurship actually making a difference in the sick care system? And the problem is there's still inequity and there's still a greater divide now being created between the haves and have-nots. So this will be a very interesting time, I think, for us to study, to think about whether entrepreneurs are actually, during this time, able to bridge the gap and help make the system a little bit better or not. That's one thing I found very interesting. The other points I think he made that had us both raising our eyebrows were that only 1% to 2% of professionals, especially healthcare people and engineers, are really entrepreneurial, because the way he described it is almost like it gets beaten out of us over the course of all our careers. We're not selected, quote unquote, for that entrepreneurialness. We're selected to be professionals, and we're selected to be people that uphold the standard and know the standard. So that's very provocative, because I think it makes us all think about, is that really what we're aspiring to? And, and this idea of a physician entrepreneur as someone who's not only a clinician, but also a scientist, and someone who knows how to look after the welfare of the patients, and then yet is also able to figure out how to create a business. To me, it seems like almost the trifecta of what it would take to create successful social entrepreneurship. So very thought-provoking ideas that I think Arlen is presenting to us.
Absolutely. I enjoyed it. And I hope you all stay tuned for the full interview with Arlen. We'll talk to you soon. Bye bye.
Bye-bye. Cheers.